So thanks, Dr. Pannu, for joining us. For those listening, Dr. Pannu is an orthopedic surgeon, chief medical officer, and a healthcare leader with experience as a co-founder, board member, and an investor. We'll explore today how AI and modern technology can improve patient satisfaction. Dr. Pannu, if you would like to add anything to it.
Hi, Jatin. Thanks very much for a brilliant introduction. And hello, everyone who is listening to this podcast. My name is Dr. Chaitanya Pannu. I'm a practicing orthopedic surgeon trained in India and UK and has been practicing as an orthopedic spinal surgeon in US and UK. I'm Chief Medical Officer of one of the medical devices companies from US, and I am Chief Medical Advisor for two healthcare AI companies as well. Thank you.
Amazing. So let's start with a big picture question, Dr. Pannu. What are the biggest insufficiencies that you see in the patient care today, according to your experience?
I mean, if you ask me about this question, there are a lot of insufficiencies in healthcare sector, but I think two most important inefficiencies which comes to my mind are unnecessary and administrative inefficiencies, because of which a study quoted from Journal of American Medical Associations in 2023 suggested that a US healthcare system loses around $265 billion annually, which is massive.
Yeah.
And another most important prevalent topic nowadays is physician burnout. And another study, which was quoted in one of the American Medical Association journals in 2023, suggested that around 50% of physicians reported burnout because around 49% of their workday goes just because of administrative workload. And the inefficiencies are mainly due to prior authorization problems or incoordination and inefficiencies in interoperable EHR systems, thereby resulting in around 15 to 25% of administrative costs. Thank you.
So, with these challenges that you just mentioned, where do you think technology can help the most?
Thanks for asking, Jatin, this question. And I would give you a real insight how a doctor works in US or UK. Usually a patient gets an appointment of 20 to 30 minutes. Now, when I see a patient, initial first 5 minutes, most of the patients are dissatisfied basically. And you will ask me reason why. Currently, there is such a long waiting list, especially in NHS in UK. And the healthcare is so expensive in US that patients doesn't come on the first problem when they see. They keep it there for a while and then show it to the physicians. Now what happens? They are all dissatisfied. So initial 5 minutes goes, 5 to 10 minutes goes in just satisfaction as well as introduction, then satisfying patients, talking normally, and then caring for them so that they get easy and the communication flows afterward very well. Otherwise, both the parties, physicians as well as patients, are poles apart. They can't communicate. When you have set that scene, then comes the real problem. You start asking patient what are their problems, why they have come to the physician. And then suddenly you feel that patient doesn't know anything about the disease or anything, whatever they are suffering from. Or even if they know something, they have gathered that information from so many false information places over the internet that they have so far-fetched ideas about their conditions that it takes a lot of time for a physician to bring them back on the topic, or let's say on the problem which they are facing currently. And then patient, after taking a long history, then starts examining the patient. And then finally, what happens in last 5 to 10 minutes of that appointment? All the ideas are running into physician's mind that what they have to do next for the patient care. But then patient wants to know lot of information at the same time because they have so many questions built up over, let's say, waiting for 6 to 8 months. They want to ask on the physician and clarify all their doubts. Now, in that time, physicians are also not able to concentrate that very well on patient care. And what happens? Physician end up almost 15 to 20 minutes or sometimes hours after that one patient appointment on administrative jobs. Let's say filing for investigations, making referrals, or even dictating letters or checking correspondences about different investigations for the same patient. Now that what happens in this process, as you can understand, that physicians shortage is there, and there are less number of physicians taking care of more number of patients each day.
Hmm.
So the workload is increasing. First problem is that. Second problem is physicians want to take care of patients as the best as they can. They don't want any dissatisfied patients. So that intention of being the best and they're trying very hard. They sometimes are not able to take care of those patients that well. So that kind of dissatisfaction just builds up inside their mind, basically. And then there is no emotional support in the workplace. Nobody is able to understand what's going on with the physicians. That's also another reason why this burnout happens. And lastly, all the admin jobs and increasing regulatory uh, things which are needed to do the paperwork, to do the stamps, or let's say do the notes for that one kind of encounter are increasing day by day. So that doesn't help as well. And on the top of it, their paycheck is also decreasing. Everybody knows about it. So all these just causes a cumulative effect on physician burnout, which is happening and which is a major issue currently. Now, what all things can be done to take care of all the physician burnout as well as provide a world-class patient care in the healthcare systems? I think AI is one answer, which probably can help both patients as well as physicians here and make the system efficient. I think if we talk about the pre-appointment care, AI can handle it very well. If you see, there are systems which are automating the appointments, the systems which are communicating with the patients, giving them a great real-time idea where they are in the queue, if they are in the waiting list, or what they should be prepared for, and what they will have on the day when they will have this appointment. In old days, nobody was knowing where the patient is before entering the hospital, when the patient is going to come for the appointment. We used to ask the healthcare assistants or the nurses on the job if we had to find one patient. Now there are apps which can tell you where the patient has entered into the hospital, where their real-time locations, so that it makes it more efficient. Of course, not every hospital is using it, but there is scope for improvement if we do that. Then comes the second most important bit, which is the patient education. In that, a lot can be done with the help of AI. Patient follow-up and patient education is one thing which can make the patient prepared for their upcoming appointments so that at least they know what's happening with their body, why they are having some problems, what all possible reasons can be for these kind of problems which they are facing currently. And where if I understand that AI is not at that level yet that it can make the diagnosis, but still it can give patients an idea of 4 to 5 conditions which can result into similar, you know, problems.
Makes sense.
And they can be very well prepared mentally what to expect, first of all. And then they will be very informed that what to ask as well for their future care from the physicians. Right now, what's happening, they don't know anything. Now, the physician is here sitting on the level of all the information and knowledge, and the patient is here. There is a big gap. Now, that gap can be bridged with the help of AI and constant follow up. And I'm pretty sure this will definitely help in patient satisfaction. Now, the third thing and the most important thing we discussed earlier as well is the admin jobs. There are so many AI based applications nowadays which can help in that, such as uh, integrated EHR systems for better flow of informations,
Mhm.
digital referral systems, which can give real-time idea about the conditions of the patients from one healthcare system to another healthcare system.
Mhm.
Then scribing, AI scribing can help into the notes. I've specifically seen specific applications which are helping in terms of ward notes as well as theater operation notes and other such notes which we have to make during patient care. And lastly, follow-up of patients can also be automated very well. I've seen remote applications taking care of wounds and their dressings. And as I'm surgeon, I always have this kind of anxiety from patients that they keep on asking, how is my wound doing? What is happening? So I've seen those applications taking care of the wound daily by taking pictures and giving a rough idea, at least to the patient, that's what's currently happening with their wound, where their care is going, whether they are doing very well, and whether they need to show it to the physician or not. So I think all in all, if you ask me, there are a lot of scope which can be helped with the help of uh, AI and automation. And I think this is definitely going to help both patients and as well as physicians.
Definitely. So looking ahead in future, uh, where do you see? What do you think the future of AI in healthcare would be?
I think the future of AI in healthcare is very bright. Uh, Slowly and steadily, it is going to come into every walk and talk of healthcare because there are so many inefficiencies in current healthcare structure across globally that these need to be passed up. And the only solution would be the AI. Why? Because from a daily day-to-day routine of a doctor, which is the costliest asset in healthcare for all the healthcare systems, if you ask me, and their time is very precious as well. Now, if they are losing their time in inefficient administrative tasks, then the healthcare system itself is losing half of their money just on unnecessary tasks. And initially and previously, because the data gathering and data processing was so much inefficient in healthcare, that's why all these technologies and advancements were not being deployed into healthcare side. But now with the help of AI, data gathering and processing can be done automatically, and it can also be deployed pretty easily in efficient manner without increasing the workload of physicians, giving appropriate personalized care to patients, and it will definitely also result in decreasing the day-to-day workload of physicians by decreasing administrative tasks.
What are your final thoughts on uh, clinics and individual practitioners who are basically looking to adopt AI at the current stage?
I think, Jatin, there's no brainer in this question. I think, and that's a curve of any technology. There are first early movers, then there are people who get aware about that technology, adoption increases, and then there is a plateau. So I would be definitely into the early mover category. And so as I would advise all the people, all the physicians and healthcare systems that they should be into early mover category so that they can adopt to the new technology. They should first try it. And if it works for them, then yes, they should adopt it and then use it as much for the betterment of human lives. So I would suggest everyone that yes, AI is the future and we should be in the future rather than in the past.
Definitely.
Thank you.
So thanks, Dr. Pannu. Thanks for your time. This has been a great discussion. I
Thank
hope to
you.
continue
You're very
this.
welcome. Have a great day.